often partner together in exercises and real world response. And so although these are the parishes that I serve, anyone across the state is welcome to reach out if there are things that I can do to assist you. We fall under what's called Emergency Support Function 8, and I often get questions about what is ESF 8. I really try to make sure that our region understands it's more than just that portal of information that's going back and forth. We are part of an organized structure at the state level. So ESF 8, or Emergency Support Function 8, is the health and medical piece. So as providers for home health and hospice, you are part of that team as well. So we are considered critical infrastructure when we think of the day-to-day living of our communities around us. And so part of our role is to help prepare those families for disasters and those patients, but then we also help them recover as well once the immediate emergency has passed. Just to give you a little bit of a snapshot, there are many ESFs under the state umbrella, and so we fall kind of there in the middle, but they range for a variety of things. So I thought it may be nice for you to for us to pull back for you to see the bigger picture of what emergency support functions could be stood up during a disaster in order to respond and then recover. Each week Jamie's kind of promoting or I guess encouraging those who are interested to take note. We do need some home health and hospice designated regional coordinators. So I'll go ahead and let you know we do not have one yet for Region 2. If that's something that you think that you may be interested in, I would encourage you to reach out to me. You do not have to be a subject matter expert. What we need is somebody who's passionate about communication between the various agencies, someone who's willing to be that communicator and pass information back and forth. It's very rewarding. I will tell you, it has been a joy to serve this area for the years that I've been involved. So if you have questions about it, please reach out to me. But one of the main things that I tell our groups is that we are not regulatory. So first and foremost, I do not represent health standards, and so I'm strictly here as a resource to you all in blue sky days, and then obviously in disasters as well. But again, please consider, if you are someone who's been participating in these meetings for quite some time, the importance of emergency preparedness. Our coalition, just to tell you a little bit about it before I hand off to our East Baton Rouge Parish Emergency Operations Center. Our coalition is actually a group of various providers, not only healthcare provider types, hospitals, home health agencies, but also our response partners. So public health, our EMS providers, Louisiana Emergency Response Network, our parish offices of emergency preparedness, who we have several of them on the call today, various other partners, really anyone that you can think of who we may partner with. We even partnered with LSU Vet School during the pandemic. So partners that you may not expect on a daily basis, they may be someone that we coordinate with during a disaster. So and that changes depending on the disaster type. The things that we have to offer here in Region 2 that make us unique, we do have a level 1 trauma center. We also have a regional burn center. We've got a children's hospital, a women's specialty hospital, and numerous other specialties and critical access facilities. And so because of that, we are often called a receiving region. So we don't typically evacuate when it comes to hurricanes and other coastal threats, but we do stand ready to help our neighbors from down south. And so the healthcare providers in our area know that we are going to surge and take on those evacuees and their families and so on and so forth. And so we do a lot of preparation and practice so that we can fulfill that role successfully in the event that there is an emergency. The other things I wanted to make mention to you that you may be interested in as home health and hospice providers, we do things for the community. Within our coalition, specifically Louisiana Emergency Response Network offers Stop the Bleed training, and that is a free service. That education normally takes a couple of hours, so if you go to their website, they've got all of the offerings listed there. You do not have to be a clinician, so if you have members of your team who are not clinicians, they can certainly take this course and successfully pass with that. The other thing that we do learn also provides a lot of education and public awareness on stroke and heart attack recognition, which, during a disaster, those things don't stop. In fact, sometimes during disasters, we will see an uptick, in stroke and heart attacks just due to the stress of the storm or the emergency. So lots of great information there that can be shared with your patients' families and among your team members. So the reasons we prepare, I've listed them here on the screen. I know that we're focused on hurricane season right now, but we really, emergency preparedness and emergency management encompasses multiple types of emergencies. And so just make sure that you consider that when you're doing your preparedness, that you are doing all hazards preparedness. And then, of course, in our regional risk analysis each year, one of the greatest threats that we have, it continues to be hurricanes, along with some other things, but hurricanes always at the top of our list. So I'll try to go ahead and wrap up. I'll share these slides with Jamie so he can push them out to you. There's some great links in the coming slides, and I won't go through a lot. I won't take a lot of time on those because we do have another presentation, but just want to make sure that we're sharing some strategies that we use here in Region 2. First and foremost, our networking and building of relationships. I know Jamie says this week after week. I can't say enough about making sure that you have introduced yourself to those in your area ahead of a disaster. It goes a long way in being able to communicate and get the resources that may be needed. Of course, we do planning and education, and then we often exercise together as well. All right. So we'll move on. Some of the things that I found really helpful were in the following slides, and I don't want to duplicate anything that our East Baton Rouge Parish MOSEP team has. So I'll quickly go through these, but just knowing that ready.gov has a number of resources. You can really narrow it down if you're trying to work on an emergency operations plan for your agency, a continuity of operations plan, and then a disaster recovery plan, which is one of the newer things that we are working on here in our region. So, there's been, a lot of things and resources out there, a lot of discussion over the years about the EOP and the COOP. Disaster recovery plan is a little bit of a newer piece of the puzzle for us. Make sure in your communications plan that you're, thinking through the various, pieces and parts. I've got some information here that you may want to consider. Some things to think about as you're working on those, or even building exercises to find where your gaps are. Making sure your team is educated. It's great to have it on paper, but certainly you need to dust those off, and make sure that your team knows where to find that information. Go through the questions ahead of time and make sure they're educated and have the opportunity to ask any questions they may have.